we're going to let people start joining. I want to thank everyone for joining us today here during October ADHD Awareness Month. I'm Keith Boswell. I go by Boz. I'm the Vice President of Marketing here at Mintavi Health, also operating ADHD Online. And I'm joined today by our Chief Medical Officer, Dr. Barry Herman, and Lakeisha Love, one of our nurse practitioners. And they are going to talk about the non-stimulant treatment options that are available for ADHD, talk about some of the benefits, some of the considerations that people might have when they're thinking about non-stimulants. And we'll let both of them just give, a brief overview of their thoughts. And then the real goal of this is to answer as many of your questions, the participants, as possible. So I would encourage you to use the Q&A function down at the bottom. You can post your questions there. We'll also be monitoring the chat, and if there's anything and everything we can get to, we will. So again, thank you for joining us. Dr. Herman, I'll turn it over to you and let you start and kind of give your first thoughts.
Oh, well, thanks, Boz. And hello, everybody. I'll introduce myself first, maybe.
Sure.
Barry Herman.
Rushing things.
As Boz said, I'm Chief Medical Officer here at Mintavi Health. I'm a board certified child and adult psychiatrist. And I spent about 15 years in clinical practice. And during my clinical practice, I really focused and kind of specialized in treating school-age children. So as you can imagine, many of them had ADHD and or related disorders. And it was really kind of the bread and butter of my clinical practice. And then for the last X number of years, my encore career, I call it, I've spent my career in industry. The last 4 years, I've been involved in digital health. And it's a pleasure to be here with you today. Would you like me to just start, Boz, or do you want to have Lakeisha introduce herself?
I'm a terrible host, so let's introduce Lakeisha, and you can give a background, and then we'll start.
Great.
All right. Hello, everyone. Thank you for joining us today. We really appreciate it. My name is Lakeisha Love. I am dual certified in both family medicine and family psychiatry. I've been practicing clinical practice for about 7.5 years. My specialty areas is general psychiatry and substance abuse and primary care. I really love enjoying the mixture of things, focusing on individuals in a holistic manner. So not only really digging into what your brain is doing, but also how your overall health is progressing. Again, I am very thankful for having this opportunity to work with the team and answering any questions that you all will have on this webinar today.
Great. All right. Well, Dr. Herman, you want to share your first thoughts?
Yeah, sure. So today we're going to be talking about the non-stimulant class of medications that are used to treat ADHD. And as most of you probably know, the current first-line medication treatment options for ADHD are the psychostimulant medications or stimulants. And there are two classes of stimulants. There's methylphenidate, and there's also the amphetamine medications. In many patients, they are quite effective, and they tend to be the first choice that practitioners use when they treat ADHD. So why would you consider not using a stimulant and using a non-stimulant medication? Well, as it turns out, about 20 to 30% of patients who have ADHD and are treated with stimulants do not do well for one reason or another. Either they don't get adequate efficacy, meaning they don't really improve that much with either class of stimulants, or they have side effects that just are very difficult for them to manage. Typical side effects from using stimulants are poor appetite, poor sleep, weight loss. You can sometimes feel jittery or kind of agitated. You can also kind of get this kind of flattened out mood. People say they feel like they're kind of zombied out sometimes on stimulants. So that's why you would consider a non-stimulant medication. There are also some, some other advantages as well. The non-stimulant medications are not scheduled drugs, meaning they don't carry the same kind of risks that stimulants do for misuse or addiction, or what we call diversion, meaning giving them to somebody else so that they can use them or abuse them. And so that for many patients, they do not want to be on stimulants. And so it really is a preference, at least, to try another option before considering stimulant medication. So there are a lot of reasons why a patient may decide they want to try a non-stimulant first, or the practitioner will decide to use a non-stimulant as a treatment option. So I'll just say a little bit more about the classes of non-stimulants, and then my colleague Lakeisha can share her thoughts a little bit. So in general, there are really like two major classes of non-stimulant medications. There are what we call norepinephrine modulators. These are medications that that affect the transmission of the neurotransmitter norepinephrine, which has been implicated in ADHD along with dopamine. And there are also medications that were formerly used as blood pressure medicines that also have been found to be effective in treating ADHD. And we'll talk a little bit more in detail about those different medications. I will say, as a caveat, that non-stimulant medications do not work as well generally as stimulant medications. They're about 50 to 60% as effective as the stimulant medications are, and their actual treatment effect, in other words, how strong their efficacy is in treating ADHD, is also not as good in general as stimulant medication. And just one more thing, sometimes clinicians opt to use non-stimulant medications in combination with stimulant medications, and there may be some clinical reasons to do that. So I'll stop right now. I'll let Lakeisha share some thoughts, and then we're happy to go into a lot more detail about this.
Yes, of course. So I'm going to go ahead and just echo what Dr. Herman was discussing about non-stimulants. What are they? They are exactly what it sounds. They're not controlled substances. They do act differently on a part of our brain, and they work quite differently than central nervous stimulants. They are safe and they are non-addictive. And they are a really good alternative route to some things that he mentioned as far as having other conditions, or maybe there's high blood pressure, other psychiatric conditions someone may have, or if it's just their first route of choice for treatment. A few different medications out there, along with the clonidine and guanfacine that he mentioned, is also Strattera, Qelbree, and Wellbutrin. Wellbutrin is very common in use, off-label use for ADHD. Strattera and Qelbree are both FDA approved for ADHD. Originally, Qelbree was for the adolescent and child population, but recently it has been approved to treat adults after they've seen that that has also become effective. Although the slower mechanism of action is different, like with stimulants, they work right away within 60 minutes. you'll start to see improvement. Non-stimulant therapy has this slower mechanism where you have to take it over time in order to see the long-term benefits to manage your ADHD symptoms. Typically, it can take about 4 to 6 weeks to see the full benefits, but you can start seeing some improvement as early as 2 weeks. The goal of treatment is to increase more norepinephrine in our brain. Now, what does norepinephrine does? If we have enough of this chemical, it helps improve our energy and also our attentiveness. So this in return will help improve impulsive behavior, hyperactive tendencies, and also improve our attention span. At ADHD, I've had the pleasure of working with many individuals and tailoring treatment approaches for their needs. Non-stimulant medication doesn't only focus on reducing the ADHD symptoms, but it also helps improve your mood and symptoms of depression. So if I have an individual who have depression and ADHD, it may make sense to treat one medication for two separate conditions. It can also improve motivation, interactions with others, decrease irritability, and also fidgety. Most of my patients select non-stimulant options because of maybe medication side effects of stimulant therapy, the risk of misuse or abuse, or having any type of history of substance abuse or addiction. And then if they're on a lot of different medications like other psychotropics, there could be a lot of different side effects. And so non-stimulants can be a safer route for them. Overall, I've seen long-term remarkable benefits of people being able to manage their time better, them feeling less distracted, having more focus, more organization, better time management. And by the second appointment, we are seeing improvements. And of course, there's going to be dose adjustments. Maybe sometimes we have to go up or decrease or even switch to a different type of medication. But there are options other than the most commonly one, stimulant therapy. There's non-stimulants, and this can benefit from pretty much most individuals.
Great. Well, and we had a comment in the Q&A. An anonymous attendee said, "I can't use stimulants because of a past history of addiction to amphetamines." And so I'm sure, there's a number of people that's a consideration.
Absolutely. Just like Lakeisha said, that might be, one of the factors that goes into deciding what would be the appropriate treatment.
Great. All right. Well, let's see. We've got another anonymous question. So this is someone that's got a combined mix of conditions as well. So what might be the recommended medication options for people with anxiety and panic attacks, ADHD, mild OCD, and depression? Stimulant and non-stimulant options what would you consider? Thank you.
Do you want to take that one? I'm happy to share too.
Of course. And so first we have to really figure out what's stemming the anxiety and the panic attacks. Is it more generalized anxiety related to ADHD symptoms and not having really good productivity that's increasing your worry? Or is it anxiety from being in social environments, objects, etc.? If it's anxiety from ADHD that's stemming or worsening your symptoms, then treating the ADHD, you will see a lot of your symptoms alleviate and your anxiety will go down. Now, someone who has an additional OCD, medications like SSRIs, sertraline, fluoxetine can be seen and improved in those options. So if you're having ADHD, OCD, and depression, you may have to be on multiple combinations of medications that will target your ADHD symptoms, and then also a medicine to help you with your OCD and depression that works both together, like I've mentioned earlier.
That's exactly right. And sometimes, depending on the severity of what symptoms are the most impairing or the most destabilizing. Sometimes your practitioner will try to address the most serious symptoms first and then add medications on top of that. So if anxiety is really the most destabilizing set of symptoms that you're having, that might be the first thing that your practitioner wants to treat and get under control. And then you can use medications like stimulants or non-stimulants to treat the residual symptoms of ADHD. OCD is also treated with SSRIs, serotonin reuptake inhibitors. So for both anxiety and OCD, you might be able to get away with just using one medication to treat both of those.
So I'll just jump in as a personal experience and as someone who was late diagnosed with ADHD at 49, had experienced a number of years struggling with anxiety and depression, and had sought treatment for that. And then finally, after diagnosis and some therapy, moved into treatment with stimulants and continue now. I'm taking a stimulant and fluoxetine. And I find that that has really made the difference for me. I mean, it has really brought a balance. It's not perfect. I still have to do all the work, but it took time and effort to find what worked right. And it wasn't fast, unfortunately. The stimulant was the fastest, acting piece of the whole thing, but that came last. So, all right. Well, another great question here from Anonymous. Are non-stimulants safe for women who are pregnant or wanting to become pregnant?
That's a good question. I don't. I think they're categorized as what's called Class C, meaning that typically, the recommendation is if you can avoid taking the medications during the pregnancy, it's always probably best, especially in the first trimester. But depending on how serious the symptoms are, sometimes the benefits of taking medication outweighs the risk of taking the medication during a pregnancy. I'm not sure, Lakeisha, if you understand it any differently than that.
Yes, of course. Usually, when my patients come to me and they found out they are pregnant, unfortunately, I do advise them to discontinue their medication and maybe elect for cognitive behavioral therapy to help with their organization skills. There's not enough studies that indicates that stimulants are safe or non-stimulants are safe. SSRIs are typically more safe in pregnancy, and I think it's because pregnant women, they don't do a lot of clinical trials to see if this medication will be safe for the fetus. Just like Dr. Herman mentioned, a lot of times we would have a collaborative discussion with OBGYN and talk about would this be safe for this particular individual? Or does the benefits outweigh the risk of them being able to continue treatment throughout their pregnancy? And we monitor them and the baby more frequently than typical.
Lakeisha, that's a really great point. I think that coordination of care and making sure that, what's happening here in the telehealth space and what's happening in the physical space, that those providers are synced up is vital, especially when you're talking about pregnancy. So great point. All right, well, let's see. We've got another question from Tahuya. It says, I currently take Wellbutrin and it doesn't work for me. Any non-stimulant recommendations for Black women who experience ADHD and anxiety?
I can answer.
Sure.
So I would probably maybe try a different non-stimulant mention like Strattera or Qelbree. The thing with Wellbutrin, because it is used off-label, some people may see the benefits of having motivation improvements and feeling tired and also concentration. But when you have anxiety tied to it, Wellbutrin can worsen the anxiety aspect. If you switch over to Qelbree or Strattera, you may have a better response with anxiety with the ADHD symptoms. So I would discuss with your provider your concerns, why it may not be working for you, and seeing if switching will show better overall improvement.
Yeah, I agree with that. And just to clarify, when we talk about off-label use, we're talking about the use of a medicine that hasn't been FDA approved for a specific indication, but physicians and prescribers are free to choose the treatments that they think are best based on the risk-benefit equation. And there is evidence that Wellbutrin, which is an antidepressant, can also be helpful for some patients who have ADHD.
Great. Well, this is kind of just a follow-up, an anonymous a comment. I've been using Strattera for 2 months and not seeing improvement. I mean, is that normal for someone to, trial maybe one or several drugs?
Well, 2 months at the right dose, typically you would expect to see improvement if there is going to be improvement. And like I said, only about 50 to 60% of patients who are using a non-stimulant as the only, first line choice for treating ADHD are going to really improve in their symptoms. And the treatment effect, the strength of the effect of treatment is just it's not as good as it is with stimulants. So I would say this is something that you would want to discuss with your provider, but generally, if you're taking an adequate dose and it's 2 months and you're not getting better, then that might be a time that you and your provider may decide that it's time to try something else.
Okay. Let's see, we had another anonymous question. What are your thoughts on nootropics and their efficacy? Or nootropics.
I've had a few of my patients who tried nootropics in the past for ADHD, and they've all reported that it wasn't effective. They might have saw some improvements, but not consistent improvements over time. It's really hard with supplements because they are made of so many different kind of chemical structures. And with nootropics, they use these synthetic molecules that may mimic stimulant drugs to try to get the same desirable results. A lot of times when we are treating conditions as providers, we are looking at evidence-based research practices and looking at studies to show what was effective in a certain demographic or population. And we back that research and we prescribe based on the efficacies. So to answer your question, I'm not sure. I don't really recommend nootropics because I don't know much about it or what's the chemical makeup. What about you, Barry?
No, I agree entirely with what you just said, Lakeisha, and the evidence is just not there. So we just don't know that really that any nootropics out there can be helpful. The one thing that I can mention is the alpha omega fatty acids, which there has been some research on that has showed some very modest treatment effects for ADHD, but in general, the weight of evidence does not really support their use for treating ADHD. I might add just one more thing. I mean, we've been talking about medications here, but there are other non-medication approaches to treating ADHD alongside the different kinds of psychotherapies, CBT being one of them that Lakeisha mentioned. And for example, there are some really exciting new devices that are out there that are being utilized for treating ADHD, like trigeminal nerve stimulation. The trigeminal nerve is a big nerve that runs in your face, and there's actually a medical device that delivers an electric stimulation to that nerve. And there's actually some very good data out there. The FDA approved it for its use in treating ADHD. Also, there's a video game out there that has been FDA approved for improving attention function in some people, some kids and adults now who have ADHD. It's not approved as a first-line treatment, but it's approved as a combination treatment. So it can be used in combination with other medicines and other therapies to treat ADHD. So, I mean, there's a lot of exciting new things that are happening that are outside the realm of even medications going on right now.
Great. All right. Well, we've got plenty of questions coming in. So let's see. Aaron asked, my son tried a stimulant, but it resulted in facial tics almost immediately.
Yeah.
Do non-stimulants have this potential side effect?
No, but that I'm glad that you mentioned that, because that is obviously an unwanted side effect that can happen. Fortunately, it doesn't happen a lot, but it does happen. It kind of uncovers tics, and you definitely do not want to continue taking stimulants when that happens. Fortunately, as far as I know, none of the non-stimulant medications has been associated with unmasking or causing tics. And I don't know if you're familiar with any cases of that, Lakeisha.
Yes, I usually treat adolescents and up, but I haven't had anyone on non-stimulant therapy that developed tics.
Yeah.
Great. All right. Well, we've got another question. I didn't realize how difficult it was to focus until I left corporate America to become a full-time entrepreneur. I'm struggling with this ADHD. Would like to find a non-stimulant that works besides Wellbutrin, and my friends recommend CBD. Any suggestions?
I don't think the evidence is there for using CBD for treating ADHD or improving focus. In fact, for some people, it may actually defocus you, but I just don't think there's any weight of evidence right now to support its use for treating ADHD.
Well, and we know that entrepreneurs, a high number of them have ADHD, right? A large percentage. It seems to be kind of a characteristic trait of kind of I think maybe the multiple tabs being open gives you that ability to see things maybe that others don't, but it certainly doesn't make it any easier.
No doubt. Yeah.
Well, good luck. And we are publishing articles routinely through Mentavi website and on ADHD and talking about entrepreneurs. And so, please do follow up and, hope things go well. So we've got a question from Paul and a comment as well. So he says, I have to call in to question your claims that these medications are safe. No medication that takes time to work and then has withdrawal symptoms if you stop can be considered safe. Non-stims are a second line of defense for a reason. At least when I stop a stim, it stops. When stopping a non-stim, you can have catastrophic effects. Also, could you address that major depressive disorder and generalized anxiety are way overdiagnosed for people with ADHD and a fair amount of the time. Once ADHD is addressed, additional medications are not only not necessary, but can be detrimental.
Of course, I can take Paul's question. And of course, you are right to say that all medications are safe. To clarify what I meant by it's safe and effective is that you don't have the extra worry of it being misused or abused or adding with other substances that can cause overdose like stimulants can. And so it is a safer route for those who have a history of addiction and substance abuse. Of course, when you are stopping any type of antidepressant medication, you have to taper those medications very slowly. And we do an outstanding job of tapering them off. This can take 3 to 6 months, depending on how long someone has been on a medication. The discontinuation symptoms are not very fun to deal with. So I always recommend my patients to let me know when they no longer want to take it so we can come up with a plan together that they can safely be taken off these medications. And yes, you are right. Sometimes when someone has ADHD, depression and anxiety overlaps it and it's diagnosed as well. It's really hard to know what is what because ADHD, depression, anxiety look very well similar. You can have restlessness, intrusive thoughts, feeling sad, being unproductive, lack of motivation, not sleeping with all three conditions. The goal is when we are doing our assessments at ADHD is to evaluate each individuals to see if they are struggling in multiple areas. And sometimes we do a one treatment approach. If we feel they have anxiety and depression, we treat that first. And then if the ADHD symptoms are still continuing, then we add on a medication or we treat the ADHD first and see if the depression and anxiety improves depending on what may be causing them to feel depressed or anxious.
Yeah, I totally agree with Lakeisha. And, you know, no medication is innocuous. They all have potential side effects. And for every individual patient, there's going to be a differential way that they respond to that medication. And that's why informed consent is so important and why the patient really should have a significant choice in making decisions about the treatment that they receive. So the process of informed consent is to always tell the patient as much information that you can about the potential benefits, the potential risks, the side effects, and the alternatives to use of any treatment, whether that's medication or any other kind of treatment. And yes, stopping medications abruptly, especially the non-stimulant medications, can create significant problems. Not just the norepinephrine modulator medications like Strattera and Qelbree, but also the what we call the alpha adrenergic agonists, those blood pressure medicines that are also used to treat ADHD, like guanfacine and clonidine. And those medications, when you stop them abruptly, can actually cause significant increases in blood pressure that can, in some people, be potentially dangerous. So yes, you have to be very respectful and careful about any medicine that you're going to prescribe. And as a patient, you should always have a choice about the kind of treatment that you receive.
And I mean, do you want to speak about the overdiagnosis kind of like question in that? Because from my own experience, I think I dealt with providers that did not, before I was diagnosed, I dealt with providers that did not have an understanding of ADHD. And so because I didn't fit the profile of typical, hyper boy, that I think still so many people have in their head, I was often classified as like, what's depression or anxiety? It couldn't be ADHD.
Yeah, well, Lakeisha is absolutely correct. When you have co-occurring conditions like ADHD and anxiety, or ADHD and depression, or ADHD and anxiety and depression, it's oftentimes very difficult to tease out and determine what is contributing to what in the way of symptoms. But there has been a tremendous amount of research that's been done in this area. ADHD has been around for a long time, and so have these other conditions. And we do know that ADHD commonly co-occurs with other conditions. So we know from the research that about 80% of patients with ADHD have at least one additional psychiatric disorder. And typically the most common co-occurring disorder would be an anxiety disorder. I think that's up to 50% of patients with ADHD can have a co-occurring anxiety disorder. And then for depression, about 30 to 50%, depending on the research that you read, can have depression as well. And there are other co-occurring disorders that accompany ADHD, like substance use or substance abuse. That can be common in children. It can be conduct disorders. It can be OCD, obsessive compulsive disorder. Unfortunately, psychiatric disorders, frequently don't just occur solo, by themselves. They commonly co-occur with other disorders. The important thing is to carefully assess, really spend enough time and to carefully assess the symptoms that the patient is experiencing in their history, to be able to really make that diagnosis, or at least have a differential diagnosis that you can observe over time to be able to determine what in fact is really going on with the patient. Sometimes it takes a little bit of time to tease out what is contributing to what in order to make the proper diagnosis.
Yeah, I mean, it makes sense. And oftentimes we don't get the time to really share with our providers everything they need to know.
That's right.
All right. Well, let's see. We've got another question from John. John said, I tried Strattera, but I had a seizure. Sorry to hear that, John. What are some other options? And he's looking for a psychiatrist in Missouri and St. Louis. We do offer treatment services in Missouri. So, but his question about Strattera, or other options.
Yeah, well, I don't want to address specific cases
Right.
without actually having examined a patient. But in general, I can say that some medications can lower what we call the seizure threshold, and so they can bring out a seizure. Not sure that that's a common side effect of Strattera, but that's something that you would want to discuss with your provider. And if you haven't had any kind of a workup, anyone who has a seizure, in my opinion, in general, should have a neurological workup at that point, because there are a lot of reasons that you could have a seizure. It may have been a coincidence that you had a seizure in relationship to taking a certain medication, but always that's something that should be evaluated further.
That makes sense.
Agreed.
Okay, so let's see. We've got another question. Do you always recommend a non-stimulant for someone with high blood pressure who is already on blood pressure lowering medication?
I can take this one. So because I am certified in both family medicine and psychiatry, it's on a case-by-case basis. First, you need to speak with your provider in terms of your medical history and the history of your high blood pressure. We would need specific details of what your blood pressure is, what has it been, the type of medication that you are currently taking, And before starting any type of stimulant medication or non-stimulant medication, it's important to have a EKG. Some of these medications can increase the blood pressure and also increase the heart rate. So sometimes we have to collaborate with the primary care provider and get a clearance because they're the ones that's managing your medical side of things to see if this medication is safe for you based on the treatment that they're doing for you. And it's not unlikely that people who have high blood pressure are on in either stimulants and non-stimulants. Non-stimulants are safer. Stimulant therapy do increases those risk factors. So it really depends, and a careful evaluation is needed.
I totally agree with Lakeisha about that. In general, I can say that it's not recommended to use stimulants for anyone who has uncontrolled moderate to severe high blood pressure. So that is that's one of the things that really would promote not wanting to use a stimulant medication. But as Lakeisha said, every individual is different, and really very careful consideration has to be made in terms of the risks and benefits for patients who have high blood pressure or any other kind of cardiovascular disease.
Okay. Let's see, we've got a question now. It says, my son 15 is taking Zoloft 100 milligrams in the morning. I would like to try a non-stimulant other than Strattera. He hasn't been taking anything for ADHD for over 6 months now, but he's in high school and I want to help him. Which drug might be one I could choose for him?
Do you want to take that, Lakeisha?
Yeah, so I don't really want to give specific details and what medication may be best for him because he's not under my care. But what I can tell you that if he is taking Zoloft, which is a SSRI, if he added Strattera, there could be more side effects for him. And sometimes often combining those type of medications can increase his risk factor for something called serotonin syndrome. His provider may want to discontinue a medication and try something else. There are other medications, just not Strattera, Wellbutrin, and Cobri, but there's clonidine and guanfacine that we haven't really talked about a lot. And although these medications are also used for helping with heart rate and blood pressure, there's a lot of good research that helps with the impulsive side of ADHD and also focus in the adolescent population.
Great. All right. Let's see. We've got another question. I was just diagnosed with ADHD at age 53, explains my whole life, but have high blood pressure under control with lisinopril and have been on 100 milligrams sertraline for years for anxiety, panic attacks. Very curious to try a non-stimulant to see if it would help my executive function. I've got a follow-up question, but I'll let one of you take that first.
Well, I mean, I can take that. I can take that. Again, can't comment on your individual case without, examining you and having you be under my care. Yeah, executive functioning. For those of you who may not know what that means, it's really a set of cognitive skills that are higher order cognitive skills that involve judgment and working memory and other high order executive decision making, judgment, and we know that especially in adults with ADHD, they often have executive functioning impairment. I'm not really sure what the evidence is for the non-stimulants for improving executive functioning. I think Kelbry in their clinical trials did have some executive function outcome measures, but I really frankly don't recall. whether there was any significant improvements seen. Otherwise, I would suspect that they would be in the package insert in the label for that medicine. And I don't know, Lakeisha, do you know anything about that?
No, not towards executive function.
Yeah. So yeah, we do know that executive function is kind of the elusive, symptom, in that so far there hasn't been any, real good treatment for improving executive function. We do know that cognitive skills training, non-medication approaches can be helpful. So there are besides CBT, there are coaches and other therapists who work with patients on their cognitive skills, and there are kind of cognitive exercises, exercising your brain, if you will, that can help with executive function.
Great. Let's see. We've got a question from Stacy. She said, I tried Strattera and it made me so depressed. I have clinical anxiety as well as major depressive disorder. Can you spell that other name you were saying? I guess it's the other medication. I'm not sure which.
Wellbutrin or Kelvin?
I'll type both of those in. I know how to spell them, so I'll put those in. And then we've got some other questions about stimulants. If we have time, I'll get to those, but just in the interest of answering all the non-stimulant related questions, I'll go to those first. We will do another session in the future, just answering questions related to stimulants. We've had a number from previous ones, so I'll get to those. But let's see. Mary said, have you seen any benefit from ariprazole for ADHD symptoms? I've heard that dopamine modulation can be helpful.
Well, aripiprazole is an atypical antipsychotic medicine. Hasn't been studied, as far as I know, for ADHD. So I don't think there are any data out there to support its use in treating ADHD.
Okay. So let's see. Medical question. So if someone has heart murmurs, is this similar to like high blood pressure? Are there non-stimulants that generally would be recommended because stimulants might be off the table?
Yeah, if you have any type of history of cardiac conditions, a cardiac clearance is needed. So once you meet with your clinician to discuss different treatment options for non-stimulants, the cardiologists have to get clearance to see if that medication is safe. And the reason is because we may not have any type of records of what type of heart murmur you do have. If you're having chest pain or shortness of breath associated with it, is there any type of irregular heart rhythms? And really speaking to your clinician about your medical condition so they can collaborate with the cardiologist is very important.
Yeah, I will add that a heart murmur can be caused by a lot of different things, not just one thing. And a heart murmur can be not that serious, and it can be very, very serious. So it's really important to be under the care of a cardiologist, and any decisions about medication should really be a decision that you and your cardiologist and primary care physician, make together.
Great. All right, let's see. We've got a question from Roberta. She said, what are the normal side effects of non-stimulants? My 13-year-old has ADHD and is not medicated. He has anxiety and we've tried stimulants, but the stimulants made his anxiety worse.
Well, it depends what class of non-stimulants you're talking about. If you're talking about Strattera and Qelbree, they have different kind of side effects than the antihypertensive medicines clonidine and guanfacine. So I'm in general, as a class, for those two classes of medications, that there are very similar kinds of side effects that are reported. So I don't know which
I would
class of
probably the
non-stimulants we're talking
Wellbutrin
about.
and probably the probably the Strattera.
Strat
Well, yeah. The,
yeah, there are a lot of side effects that have been associated with Strattera: nausea and vomiting, decreased appetite, constipation, headache, dry mouth, drowsiness is very common, can disrupt your sleep. Um, it can actually increase your blood pressure sometimes. Um, so everybody's different. Like I said, some people tolerate these medicines very well, and some of them really don't tolerate them well at all.
Lakeisha, did you have anything you wanted to add?
No, I agree with everything he said.
All right. Let's see. We had an anonymous question. Are there any vitamins or supplements that are helpful? And what about diet and exercise?
Yeah, of course. I always like to advocate for diet and exercise just because it's just going to have better benefit for your overall health. I usually tell everyone to do at least 3 to 4 weeks of 30 minutes of moderate activity. That could be just taking a walk, or you can go to the gym and actually have a full flash workout. When it comes to diet, you definitely want to choose healthier food choices, trying to eliminate as much caffeine as possible because too much caffeine, you can experience a crash and fatigue that impairs your focus. And then also trying to decrease the amount of sugar in your diet, less processed foods. When it comes to sleep, that's very important because just think if you don't get a full night of rest, you can not feel very focused for the very next day, at least 8 to 9 hours. Vitamin B12 is a good supplement that helps with like memory and concentration. Most people with ADHD, especially inattentive type, may be very forgetful with small chores. Taking a small supplement every day or even supplementing vitamin B12 type foods in your diet can also help with your brain function.
Yeah, and again, just to underscore that there really is not a lot of evidence that vitamins per se are that helpful in ADHD, but we do know that alpha omega 3 has been studied, and it has been shown to have, at least in some studies, a modest improvement in ADHD symptoms, but modest, with a key, emphasis on the word modest.
Got it. All right. Let's see. Abigail asked, she said, newly diagnosed with ADHD and attentive type and have been prescribed Wellbutrin to start. What's the average time frame for it to reach full efficacy?
Do you want to take that,
Yes.
Lakeisha?
Mhm. Yep. So usually it takes about a good 4 to 6 weeks to see the full benefits. Again, by week 2, you should start seeing some small notable changes. By week 4 to 6, you and your clinician will have a better idea if it's working or if it's not working. And then dose adjustments can start by week 4.
Great. Let's see. We had an anonymous question. Said, hello, I was wondering if any of the non-stimulant medications are more affordable than others. This is in context of someone who'd be paying out of pocket with no insurance. I'm currently in between jobs and have had difficulty refilling my stimulant medication, so I'm considering exploring other options.
Well, in general, any generic medicine, meaning not a brand name medicine, is going to be cheaper. It'll be pennies compared to, dollars that you're paying for brand name medicines. So I believe Strattera can now be prescribed as its generic atomoxetine. So that should not be that expensive. I don't know what the prices are to be honest with you. But Qelbree, which is a new branded drug, unless you have insurance, you're going to be paying a lot of money out of pocket for a brand drug. Now, some companies offer plans for discounting their medicines for people who qualify. So it's always possible that you can look into that. But again, if you're going to have to pay full price out of pocket, it's better to look at generic medicines.
And Barry, do you want to, or Dr. Herman, do you want to speak at all about, we know that Vyvanse just recently went generic, and that was, one of the first times a new generic in the stimulant class had come on. And, we've been in the midst of this shortage, so we know enough people are going through this.
Yeah. Well, that was a big deal because Vyvanse was the market leader as a stimulant in treating ADHD. It had, I forgot what the percentage of the market it actually had, but probably close to 20% of the market that was using a branded drug was using Vyvanse. And now 14 companies have been approved to manufacture a generic version of Vyvanse now that it's gone off patent. And it went off patent earlier this year, 2023. And that should hopefully help alleviate some of the medication shortage that we've seen with the stimulants. May take a little bit of time to catch up with that shortage, but now that so many companies are able to manufacture it, it will hopefully address that shortage and also make it much more affordable. Because as I said, generic versions, especially when multiple companies are manufacturing them, that will drive the costs way down. You'll be paying pennies on the dollar instead of what you would have to pay for the branded drug.
Great. All right, let's see. We're getting close to the top of the hour. We've got a lot of questions left, so I'll just let people know we're not going to be able to get to them all, but we really appreciate them. We do use these as ways to generate future content, and certainly we'll do our best to address all of them. Just looking quickly at the ones that are left. An anonymous question about, are non-stimulants an option for adults who have PTSD and cardiovascular issues? Does that?
Yes, yeah, PTSD, cardiovascular issues with the right evaluation and collaboration, it can be an option.
Great. And then let's see. I'm just trying to see if I can get one that would be one we could close on. There's a question about what about an interactive metronome, like timing? And then they're also asking about, Elizabeth's asking about doing CBT and OT together. I'm not exactly, I've got to look up OT. I'm not sure what.
Occupational therapy.
Okay, that's what I was wondering. Do either of you have thoughts on that?
CBT
Well,
and
in general, it is recommended that patients not just have medication for treating ADHD, that they have some other form of therapy or therapies to accompany the medication. So I'm not that familiar with OT for use in ADHD, more for different kinds of developmental disorders where it can be enormously helpful. But yeah, CBT coaching, cognitive skills training, all of those things can be enormously helpful accompanying the use of medications to treat ADHD.
yes, and just to echo, occupational therapy is usually for occupational, so things as far as like dressing, clothing, cooking. Usually when people have ADHD, they don't struggle with that because of developmental wise. It's more so getting the actual task completed.
Well, I think with that, we'll close for today. I want to thank you both for your time and expertise and sharing it so generously with everyone that joined us. We want to thank everyone for joining us here today. For those that have joined, and we will put up a replay on our website. It usually takes us a day or two, but we'll get that up and you'll get an email notification when this goes up. Also want to thank you, as part of ADHD Awareness Month, we are running a promotion. So if you use the code, if you're interested to take our ADHD assessment, which also screens for anxiety, binge eating disorder, depression, and social media usage, problematic social media usage, you can use the discount code webinar23, and that will save you $23 off the normal price of $179. So thank you all again for joining us today. Thank you, Dr. Herman and Lakeisha, for your time, and we will see you all again soon. Bye.
Thank you.